Mr. President. And let me echo your words about all the dedicated men and women on the White House Coronavirus Task Force, and the team that you assembled in January, and some of whom are with us today: Seema Verma with CMS, Admiral Giroir with the U.S. Public Health Service, Dr. Steve Hahn of the FDA, and others represent a level of commitment and dedication that's been inspiring for me to have the privilege to work with. And so I thank you for your gracious words. That White House Coronavirus Task Force met today. It was reported to us that at this moment, more than 746,000 Americans have tested positive for the coronavirus. Fortunately, more than 68,000 Americans have fully recovered. But sadly, more than 41,000 Americans have lost their lives to the coronavirus. And we always want to express our deepest sympathies to the families in their loss, as well as to all the families who have loved ones that are struggling with this disease. Today, we've seen encouraging news, again, about our progress as a nation. President Trump reflected on those momentarily, but the Coronavirus White House Task Force today learned that our large metro areas continue to stabilize and even see progress. The New York metro area, including New Jersey, New York, Long Island, Connecticut, and Rhode Island, all appear to be past their peak. The Detroit metro area also appears to be past its peak and is stable. New Orleans metro area actually is the most stable of all areas where we had a major metropolitan outbreak. And the Denver metro area is stable. We're dealing in Colorado with a meatpacking plant issue. And of course, California and Washington remain low and steady. Areas that we continue to watch carefully on the task force include the Chicago metro area, Boston metro, and the Philadelphia metropolitan area. The progress that we are making is a tribute to the American people. It's a tribute to state and local leaders in all of these areas and the partnership that our president has forged. But we just want to encourage every American, as we see this progress, to continue to heed your state and local authorities. I think the American people know no one wants to reopen America more than President Donald Trump. But I want to assure you, we're going to continue to work with governors of every state, with the president's guidelines for opening up America again, and we're going to work in a way that we can consolidate the progress that we have made and help move our states toward reopening our country. We also received a report today, and the Coronavirus Task Force, at this point, 5,528 military personnel have been deployed across 24 hospitals and facilities, and 28,700 National Guard are on duty. On the subject of supplies, the President spoke about this at length, but at the present moment, we have more than 9,055 ventilators on hand. We actually added 91 ventilators to that supply because of the production that the President and our task force at FEMA has activated. In the next 7 days, we'll be adding 576 ventilators to the strategic national stockpile. As the President mentioned, our air bridge continues to work, 64 flights completed, 50 more flights on the horizon, literally bringing in medical equipment from around the country and around the world and deploying it to critical areas. Finally, tomorrow, as the President announced, we'll be hosting a conference call with all of the nation's governors, all the states and territories from the headquarters at FEMA. And we'll be working with the governors to ensure them that we're helping them to review and evaluate the President's guidelines for opening up America again, the criteria that we believe is appropriate and necessary before states can move into any phase 1 change in the mitigation strategies, but also at the President's direction tomorrow. We'll be providing all the nation's governors and all of their health officials with detail about the testing infrastructure that exists all around the country. will be specifically providing governors and state health officials with information about all of the lab capability that exists in their states, and also we'll be updating them on our efforts to identify the kind of supplies the President just held up, and our efforts to make sure that those supplies are at all of those laboratories as the need should arise. Remember that a month ago we had done 80,000 coronavirus tests in America. This weekend we cleared more than 4 million, and we're currently testing more than 1 million Americans a week. We fully expect to actually have tested more than 5 million Americans before the end of this month. But at the President's urging, we're going to continue to scale that testing and then work with governors to make sure that they can manage and implement and deploy that testing in the manner that will most support their efforts to move their states forward. Remember that the testing that is contemplated in the guidelines for opening up America again for phase 1 are testing people that have symptoms that may be coronavirus, and then also having the testing resources to deploy to vulnerable communities, nursing homes, or other vulnerable communities that we have identified as needing additional what is called monitoring or surveillance testing. We believe we have the testing today around the country that would allow any state in America to move into phase 1 if they've met the other criteria of 14 days of consistent declines and strong hospital capacity so that the system would not be overwhelmed in the event of a flare-up. But we're going to be working with governors tomorrow on the subject of testing and supplies. And as the President said again this evening, we're here to help. We've forged a partnership with governors around the country, and tomorrow we'll be building on that partnership to hopefully arrive at the day that we can make sure governors around the nation have the best advice and the best resources to put America back to work. Thank you, Mr. President.
Thank you, Mr. Vice President. Mr. President. So just a few weeks ago, we stood here and asked the American healthcare system to delay elective surgeries and procedures. And the reason why we did this is we wanted to make sure that the healthcare system could deal with any surges. We wanted to preserve equipment and make sure that they had the appropriate workforce to handle any surge. And our healthcare system did a fantastic job. They very quickly stood up telehealth services, and under the President's leadership, we started paying for these services under the Medicare program. But the reality is not everything can be addressed by telehealth. There may be a woman that needs surgery for breast cancer, somebody who has cataracts in their eyes that need to be able to see better, and sometimes a doctor just needs to be able to listen to their patient's heart. We've heard across the country that doctors' offices have closed and many healthcare systems are furloughing their staff, nurses and doctors. Under the President's leadership, we've put out over $90 billion in accelerated payments under the Medicare program, provided $30 billion of grants with more dollars on the way. But thanks to the American people, we are in a much different place. You heard from the Vice President that there are many places around the country where they're seeing a decline in cases, and hospitals are reporting that they have unused capacity. And so as part of our Opening Up America, we are issuing guidelines today about how we can reopen the healthcare system. So these are recommendations around phase 1. Now, every state and local official has to assess the situation on the ground. They need to make sure that they can still address surges. They need to make sure that they have adequate supplies and a plan for conserving supplies. They need to be able to screen patients and healthcare workers for COVID virus. And they need to make sure that patients feel safe when they come in to seek healthcare services by assuring that they have the appropriate cleaning in place and that they observe social distancing inside the healthcare facilities. And this isn't going to be like a light switch. It's more like a sunrise where it's going to be a gradual process. And healthcare officials across the country and healthcare systems need to decide what services should be made available. And ultimately, doctors and patients need to make decisions about their healthcare services. And we want to make sure that systems are reopening so that they can stay open and doing that in a very measured way. And I want to thank all the healthcare workers on the front lines have done a fantastic job in providing care and comfort, serving as a liaison between family members. They've done a fantastic job, and we owe a debt of gratitude to them. And to all those providers that did adhere to our guidelines. They did the right thing, and it has made an extraordinary difference. I also want to take a couple of seconds here to talk about our nursing homes. Our hearts and minds are with the patients and the families of those living in nursing homes. This is an extraordinarily difficult situation. People living in nursing homes are of the most vulnerable patients. They're elderly. Many of them have underlying health conditions. And this has been a very hard situation. And I really appreciate the strong efforts of governors and local communities that have shown great leadership in supporting nursing homes across the country, particularly Governor Baker, Governor Hogan, that have had special efforts around supporting nursing homes. FEMA is also working on a plan to make sure that nursing homes have the supplies that they need. And just last week, we increased the reimbursement in the Medicare program for high throughput tests. And we are also paying for labs to go out to nursing homes to collect samples. And that's going to really support efforts on nursing homes in order to isolate patients. Today, we are also announcing, under the President's leadership, an effort around nursing home transparency. It's important that patients and their families have the information that they need, and they need to understand what's going on in the nursing home. And so today, we are announcing that we are requiring nursing homes to report to patients and their families if there are cases of COVID virus inside the nursing home. We are also requiring nursing homes to report directly to the CDC when they have cases of COVID virus. And this is very important, as you've heard Dr. Birx talk about. As we reopen the United States, our surveillance effort around the COVID virus will also begin in nursing homes. And so by having this reporting system, this will support CDC's efforts to have surveillance around the country and to support efforts around contact tracing so that we can mitigate the spread of the virus in those communities that show spread starting in the nursing homes. So again, I want to thank all of the local officials that have done an amazing job in supporting the nursing homes, and would urge all state and local leaders to follow their lead and do everything that we can to keep nursing home residents safe. Thank you.
There's an epidemiologist at the University of Alabama in Birmingham who's actually a COVID-19 survivor, and his name is Michael Say. And his question is this: why would the virus suddenly be different? And why would people's susceptibility be any different on May the 1st, or on June the 1st, or on July the 1st? And this all relates to reopening the economy. Can you explain or give an answer to that particular question?
I don't think we have evidence that one would be more susceptible or less. What I think we can say is that the mitigation efforts have really helped with respect to this, and that what we've seen is the number of cases have gone down. And if we follow the gating criteria for the opening, we're then able to institute phase one and have the appropriate measures in place to actually reduce any chance of flare-up of the cases.
Is there a chance of a sort of rebounding if you reopen too soon without the type of mitigation efforts that we've had still in place?
Yes, there's a chance, and I think Dr. Fauci and Dr. Birx talked about this at the podium. And the key here is the surveillance that is being put in place with the CDC. I think that'll be a really great help in terms of trying to reduce that risk. Thank you.